If you're seeing hair loss where it seems like your part is getting wider or thinner, maybe along the sides or the back of the crown, listen to this.
Hi, dermatologist here. Hair loss is something that's really important to me, not only because I've treated like countless patients with it. I also had my own experience with hair loss. I have suffered with a condition called telogen effluvium in the past. I've talked about it here before. It's gotten to the point where the term root cause is just like I feel like a pseudoscience dog whistle. So I looked into this creator a little bit. First thing on her profile says she is a doctor that helps people with, I think, hair loss and weight loss. Dig a little deeper. She's a naturopathic doctor. So first off, I feel like that's just a little bit misleading. Hair loss is a medical problem, and if you're talking about hair loss a lot and saying you're a doctor, people are automatically going to think that you're a medical doctor. And anytime I get on here and talk about naturopaths, people will leave me angry comments. Look, naturopaths are not medical doctors. It's simple as that. No matter what gripes you have with our medical system, that is just the truth. And I understand people's frustrations. I am very frustrated with the healthcare system too, as a doctor. But let's hear what she has to say.
This hair loss pattern is classically seen in what we call androgenic alopecia. This is hair loss due to elevated androgens. Now, what are androgens? Androgens are those quote unquote male hormones, things like DHEA and testosterone. Yes, those hormones can result in hair loss, but we have to ask the question, why are these androgens higher in the first place?
Okay, so it looks like we're talking about androgenic alopecia. Right off the bat, we have a misunderstanding of what it is. Androgenic alopecia is the most common type of hair loss that we see. It can be referred to as male pattern or female pattern hair loss. Those patterns are going to be different. The female pattern is a little bit more in the crown, whereas the male pattern has bifrontal recession and thinning at the vertex, so like this part of the scalp. The way that I explain androgenic alopecia is that in most people, it's really more of a trait than it is like a disease process. It is due to the presence of androgens, like this creator is saying. However, the big issue here that she's missing is that it also has to do with one's sensitivity to androgens. The easiest way to see that is looking at men. Men will have more abundant androgens, and that's the reason that we usually see hair loss in men earlier. However, we can see the difference in sensitivity to those androgens. That's why some men start losing their hair in their 20s, and some men still have a full head of hair in their 90s. There's a whole lot of men out there with androgen levels that fall within the normal range that are going to have hair loss at different times in their lives. And the reason for that is that genetics determine how sensitive we are to those androgens. In women, we're going to have different sensitivities too. Androgenic hair loss tends to show up in women at a later age. Part of the reason for that is that androgens are not as abundant in women. So if you need the perfect storm of sensitivity and androgen levels, it's not there until later on. So, yeah, you don't need to have an excess of androgens in order to develop androgenic alopecia. We're missing like the whole discussion of genetic predisposition here.
In the vast majority of the female patients that I see in my practice with androgenic alopecia, there is an underlying issue called insulin resistance. And it's actually the higher levels of insulin at the levels of the ovary and the liver that's resulting in the elevated androgens. So when it's recommended to take things like birth control or spironolactone, that might help with the androgens from a symptomatic perspective, but it is not addressing the root of the cause, which is the hormone insulin.
So here I'm seeing something that I see with a lot of content online, taking a very base understanding of something and extrapolating it out without realizing actually how complex the issue is. I think where she's pulling all of this from is from PCOS, polycystic ovarian syndrome, which is a very complex syndrome. that can lead both to signs of androgen excess and to insulin resistance. And while those two are intertwined, it's a much more complex relationship than just like insulin resistance leading to hyperandrogenism. And in fact, one can have PCOS and androgen excess without having insulin resistance. And in people without PCOS, we could have insulin resistance without signs of hyperandrogenism. I feel like this is just kind of a dumbing down of the whole topic. However, I'm interested to see what this doctor can offer people. It's interesting. I looked at her websites and it looks like she's sending people to somewhere where they could order their own lab tests, which for something like this, hyperandrogenism, hair loss, I think you really need somebody who knows how to interpret those results. So just ordering them on your own may not be the best thing. In addition to that, like if you discover that somebody has insulin resistance, what are you going to do? You can't prescribe medications. You're clearly not up to date on the newest literature. I think the reason why it bugs me so much when people who are unqualified talk about hair loss is, in some conditions, time is hair. Like the more time that you waste, the more hair you lose. Also, the fact that, like, you need skilled diagnosis in a lot of these cases. While androgenic alopecia is the most common type we see, it's not the only one. So, not all treatments are going to work for everything. And some of those conditions, like CCCA or frontal fibrosing alopecia, induce scarring. So, like, once the scalp is scarred in certain areas, hair will never grow back. And that's why it's so important to kind of catch it early. In addition to that, sometimes hair loss is a clue to something going on internally. There are cases in which you can catch things like ovarian cancer or other cancers by the fact that somebody developed sudden hair loss. And I mean, if you're just going to somebody who's not a physician and is giving you the runaround, making you take supplements, like that would never be found. So, yeah, I mean, I know everybody's just trying to get in their bag, but like, can we stop playing with people's health, please? Hair loss is a medical issue.